Good morning and thank you for the opportunity given for us to explain about our proposal research with the topic COVID-19 vaccination, current prospect and challenge in Klang Valley, Malaysia. Our group name Unity in Diversity with the members ALIYU SANI SHAWAL, EMMARELDA MASWESI BINTI AHMAD, HASSAN SABO, KARUNAGARAN KRISHNAN as our leader, YONGKIE, USMAN BALA KOFAR KUDU, myself, YANA ERLYANA, and YONGKIE ANGKAWIJAYA. This is our presentation outline. And first of all, I would like to explain about the abstract. The movement control order (MCO) as a result of the coronavirus pandemic has adversely affected the Malaysian economy and health condition of the masses. An effective and comprehensive vaccination program against COVID-19 offer the most promising prospect of bringing the pandemic to an end. This study aimed to determine the current prospect and challenge as a result of the COVID-19 vaccination in Klang Valley, Malaysia, and will be accessed through an online cross-sectional survey using a questionnaire. Background of the study. The COVID-19 pandemic that emerged 2 years ago had very significant impact on all sectors in the world. The government is trying to find a way to reduce the number of deaths or the number of the patients. Vaccination is one of the programs that are promoted through the world by each country. However, the success rate of vaccination until now has not ensured that it's run evenly. This research will discuss the challenge faced attached to the COVID-19 vaccination process in Malaysia, but it limits only to covering the Klang Valley area. Problem statement. Global effort and commitment to address COVID-19 disease primarily depend on preventive measures implemented by authorities to individuals to reduce the likelihood of infection transmission. The role of COVID-19 vaccination in complementing the individual preventive measures to confront the pandemic has become vital. Since the discovery of COVID-19 vaccine, authorities worldwide have exercised more effort to execute effective procurement and vaccination programs for individuals. Moreover, the initiation of vaccination at the country level, several issues arise related to the vaccine. The national COVID-19 immunization program in Malaysia do the campaign that was implemented in the Malaysia government and try to reduce the spread of COVID-19. The program was plagued with numerous challenges and issues. And if we look into the next slide for figure 1 and figure 2, we can see the decline of the number of COVID-19 cases in Klang Valley area is quite good since September 2021. Research objective and research question. Our research objective first, to examine the challenge faced attached to the COVID-19 vaccination process. Second, to examine the impact of COVID-19 in terms of health and well-being among Klang Valley citizens, and to identify which economic sector are affected by the vaccination success level. The research question, what are the challenges faced attached to the COVID-19 vaccination process? What are the impact of COVID-19 vaccination in terms of health and well-being among Klang Valley citizens? And which economic sector are affected by the vaccination success level?
I mentioned I'm going to present the significance of the study in 4 aspects. First, government is to provide data and crucial information for the government to find strategies to increase public understanding and the uptake of COVID-19 vaccine. In society is to reduce the attitude of misinformation shared within the society and to build awareness among netizens. In academia, to convey the relevant health education in order to enable good knowledge transfer, resulting in increased awareness to make informed choices. In economy, to explain how vaccine percentage affects nations' economic growth and economic revival during pandemic time. There are 2 SDGs applied in this research. First, SDG 3, ensure healthy lives and promote well-being for all at all ages. It is hoped that the vaccination program in Klang Valley helps to end the epidemic and reduces the number of deaths. SDG 8, promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. Bearing the challenges, the vaccination program has the potential to promote safe and secure working environments for all workers, comprising diversified economic activities. Next, literature review, government vaccination strategy. The first, Japan had researched an all young middle strategy by prioritizing younger generation after vaccinating the old age group. And in Malaysia, Ministry of Health, their suggestions and the effectiveness of vaccines are trusted by citizens, therefore influence their decision to get vaccination. The vaccination outcomes, with the occurrence of Delta variant, hospitalizations have reduced to a manageable level and deaths are reduced. For APEC economy, GDP growth rebounded to 6.1% in first quarter 2021, compared with 2.0% in first quarter 2020. The employment issue. Due to the lockdown in March 2020, Malaysia had reopened the essential economy and private sectors in May, and the unemployment rate decreases. According to Rahman 2020, the pandemic has caused disproportionate employment among those whose job cannot be conducted remotely, and specifically those with low levels of education. And there are two theories in this research. First, health belief model theory. This consists of constructs like perceived susceptibility, perceived severities, perceived benefits, perceived barriers, and cues to action, according to Lucia, Cleca, and Alfonso 2020. The second theory is knowledge, attitude, or beliefs and practice theory. According to Ernst, Pauline, So, and Liao 2020, the vaccination knowledge is the individual's level of awareness or sensitization regarding vaccinations. So this is a theoretical framework according to our topic, COVID-19 vaccination prospect and challenges.
Conceptual framework illustrates what is to expect to find through the research. The head belief model, HBM, and knowledge, attitude, belief, and practice, KAPP theory, are two popular theoretical frameworks used to explain people's behavior during the pandemic outbreaks. Combined with the quantitative method as the research methodology, the data will be gathered through an online questionnaire to identify the factors influencing the acceptance of the COVID-19 vaccine among the Klang Valley citizens. Simple random sampling will be performed using a bilingual questionnaire that will be set up using Google Form, and the generated link will be shared on the social media like Facebook and WhatsApp. Questionnaire will be consisted of both closed-ended question and open-ended question related to socio-demographic characteristic, general health status, chronic disease history, average monthly expenses, knowledge concerning general vaccination, and the COVID-19 vaccine construct of the head belief model, including susceptibility, severity, benefit, and barrier of the COVID-19 vaccine, cues to action, and vaccine acceptance. Knowledge-related question will have response option of yes, no, or I don't know. Regarding the main side effect, recommended dose interval, and recommended groups required to receive the vaccine, possible responses will be given to the respondent to select what they deem fit. And for the conclusion, good cooperation between the government agencies and the public, compounded by overall positive attitude toward the national vaccination program and low vaccine hesitancy among the citizenry, has given hope for herd immunity in Malaysia. Continuous tracking and interpretation of critical indicators are important to combat and contain the ever-evolving landscape of the COVID-19. And relating to the third and eighth SDG program respectively, it is hoped that the research vaccination program in the Klang Valley help to end the epidemic and reduces the number of deaths, and to promote a safe and secure work environment for workers, thereby increasing productivity and subsequently generating sustainable income. That's our Unity in the Diversity Group presentation. Thank you.